A lot of questions also that have come up with regards to a vaccine for kids. There's an update that's come in on that because trials are underway. Now a government panel has recommended against allowing Serum Institute of India to conduct a trial of Covovax on children aged 2 to 17 years. Now, according to sources, the expert panel of the country's Central Drug Authority advocated against granting permission to the Serum Institute of India to conduct phase 2 and phase 3 trials of the COVID-19 vaccine Covovax on children aged 2 to 17 years. The government panel reportedly cited that this vaccine hasn't been approved in any country. Serum Institute had earlier this week sought permission from the DCGI to conduct a trial of Covovax on 920 children. According to reports, the expert government panel also urged Serum Institute to submit the data that they have currently, the safety and immunogenicity data of Covovax from the ongoing trial first of adults, to go ahead and actually consider a clinical trial in children. There's been a lot of buzz about the European Union and its green pass, whether Indians will be allowed to travel. Well, the government has now taken this up. India has warned the European Union over its denial of a green pass to Covishield beneficiaries. Now, after the European Union cited norms for no green pass not for the Indian vaccine, India sent across a very stern warning to the European Union. Sources have told India today that we will now begin a reciprocal policy when it comes to exemptions from quarantine for the European countries. India has clearly told the European Union that Covishield and Covaxin must be notified in its digital COVID certificate. Under the new Green Pass scheme, people vaccinated with Covishield are unlikely to be allowed to travel to the member states of the European Union because it's yet to get the clearance. Now, former Deputy Chief Minister of Bihar, RJD leader Tejaswi Yadav and his elder brother Tej Pratap finally got vaccinated. It's not even a week since Tejaswi said that he would take the vaccine only after every single person of Bihar was inoculated. So what really made Tejaswi change his stance within a week? This news report explains.
Tejaswi Yadav has been a target of the BJP and JDU over his reluctance to take the COVID-19 vaccine. But that defiance has changed now. On Wednesday afternoon, Lalu's son Tej Pratap and Tejaswi reached Medanta Hospital in Patna and took the first dose of the Sputnik vaccine. Medanta Hospital is the first in Bihar where the Russian vaccine has been made available.
बहुत लोग बोलते रहते हैं, बोलने दीजिए, उनका अपना काम, हम लोगों ने स्पुतनिक लगाया।
The change of heart came less than a week after the former Bihar Deputy CM said he would take the jab when needed. Both Tejaswi and Tej Pratap have been relentlessly criticizing the Nitish government's vaccination drive. The JDU slammed the brothers for taking a Russian vaccine and not a homegrown one.
तेजस्वी यादव कोविड-19 के टीकाकरण को जनवरी 2021 में काल्पनिक बता रहे थे और ये अभी तक मुगालते में थे, लेकिन खैर टीका लिया तो देसी नहीं विदेशी.
What could have changed their mind is a direction issued by the Bihar Assembly Speaker that every legislator needs to get vaccinated before the beginning of the monsoon session of the House. With Rohit Singh in Patna, Bureau Report, India Today.
Let's get you the latest ground reports from our correspondents across the country. Here's a ground reality check from a village in Maharashtra that's reported the first death by the Delta Plus variant in the state. Many in the area still believe that there's absolutely nothing to worry about. There's no threat of COVID and hence are not following the coronavirus norms.
This is Ozar Khot in Ratnagiri, the village which reported the first death caused by the Delta Plus variant in Maharashtra. While the state government is losing sleep after detecting 21 Delta Plus cases, in these remote areas, there is still little COVID-appropriate behavior to be seen. Almost no one wears the mask here.
मास्क के आता कैसे ऐसे लांब से दूर से काम करता है ना अच्छा में त्याच्यामुळे काय मास्क काय आधी कसं एकत्र जर आलो.
Many here believe there is no threat of COVID in the village.
4 पॉजिटिव निकला. अभी उसको कुछ नहीं था, बुखार नहीं, कुछ नहीं. उसको अभी क्वारंटाइन किया तो उसका खेती रहेगा ना. ऐसा खेती कौन करेगा? उसका नुकसान ही हो गया ना.
They maintain that it is not possible to wear masks and get along with their work. They say they try and maintain social distancing, but then most of the time it is not possible.
In the nearby Vandre village, people claimed they had not come across any awareness program run by the government.
यहाँ पर सरकार ने, लोकल बॉडी ने अवेयरनेस कैंपेन को चलाया कोविड के बारे में जानकारी देने के लिए. यहाँ पर कोई आया क्या लोकल प्रशासन लोगों को बताने के लिए कि क्या करना चाहिए, क्या नहीं करना चाहिए?
Out of the 9 Delta Plus cases in Ratnagiri, 3 are kids aged 3, 4 and 6 years. Efforts are on to ensure the spread of Delta Plus is effectively contained.
Overall, also in the district, we are focusing on more stricter containment zones, more testing and more vaccination of the people.
The Delta variant was the major contributor to the second wave of infections. And now the sublineage Delta Plus has got everyone worried. The state government says that it is on alert mode and is closely monitoring the situation. But the fact remains, the unvaccinated population in the state is in maximum danger. With camera person Samir Shanbag, this is Pankaj Upadhyay in Ratnagiri, reporting for India Today.
On National Doctors' Day, as we as a nation come together to pay tribute to our COVID warriors, Prime Minister Narendra Modi is leading these tributes. He's put out a tweet, and I quote here, "My greetings to all doctors. India's strides in the world of medicine are commendable and have contributed to making our planet healthier." Along with this tweet, Prime Minister Modi has also attached a link to, in fact, his conversation a few days ago in his Mann Ki Baat address, where he had again spoken about how doctors have been at the forefront of fighting this pandemic. And on National Doctors' Day, we're coming together to salute our doctors for all the sacrifices that they've been making amid this pandemic to save every single life. And the Prime Minister on this day also putting out a tweet saying India's strides in the world of medicine are commendable and they've contributed to making our planet healthier. Now, many of our COVID warriors have gone beyond the call of duty and risked their own lives to ensure that others are safe. Dr. Shivani Sharma is 8 months pregnant. She continues to serve patients in Jammu and Kashmir. Here's the report.
I really feel blessed to serve the nation, especially during this pandemic. I hope we will win against this COVID-19.
Meet Dr. Shivani Sharma, Medical Officer at the Primary Healthcare Centre in Lakhanpur near Jammu Kashmir Punjab border in Kathua district. Dr. Sharma is 8 months pregnant, but that doesn't deter her from performing her duties. She calls it a war-like situation and is not ready to leave the battlefield.
Presently, COVID is like a war situation. It's a very crucial state for India. It's very important for us to be there for each other. So I just want to contribute myself to the patient who are in need. That's why I chose to work in this primary health center during this pandemic.
Dr. Sharma got the job in March this year and was straight away assigned the duty at the health center in Lakhanpur, the gateway to Jammu and Kashmir. The doctor is put on non-COVID duties, but she counsels patients with COVID symptoms as well. Dr. Sharma's family fully backs her decision to stay on the front lines.
एक्चुअली मैं मालदीव्स में डॉक्टर हूँ और फिलहाल अभी छुट्टी पे आया था क्योंकि इनकी प्रेगनेंसी की लास्ट स्टेज है और मुझे खुद पे प्राउड होता है कि मैंने ऐसी वाइफ के साथ मेरी शादी हुई है.
The local residents and health officials are all praised for the 30-year-old for her selfless service.
ये देखकर मुझे बड़ा अचंभा हुआ और इस स्टेज 8th महीने में भी ये इतनी मुस्तैदी से काम कर रही हैं, जनता की सेवा कर रही हैं. आई एम रियली ग्रेटफुल.
बहुत डेडिकेटेड है, बहुत रेगुलर हैं, बहुत पंक्चुअल हैं, बड़े डेडिकेशन से काम किया है और बहुत जिम्मेदार अपनी ड्यूटी के तहत.
While doctors like Shivani Sharma are serving the humanity in these difficult times, there are many people who are not even following the COVID-19 related guidelines. Adhering to the COVID appropriate behavior is the least we can contribute in the battle against the coronavirus pandemic. With video journalist Neeraj Kumar, this is Sunil Bhatt reporting from Jammu for India Today.
And the next story we're about to get you is about the unsung heroes of the pandemic. You rarely ever hear from them, and yet they're literally the lifeblood in India's devastating battle to save citizens from COVID monsters. Here's what we're talking about.
The fight against coronavirus. It is a war that has lasted a year and is still continuing. Leading from the front are thousands of unsung heroes. "35-year-old Sherry, a nurse at Max Hospital, is one of them. Sherry has followed the same routine for a year now. She works for 14 days in the COVID ward, followed by 4 days of quarantine. Her daughter back home remains anxious for her safety.
Yes, I have a child and 5 years old. Child is very much supportive to us. When I went back to home, and she is far away from me, and just I am taking hand washing, and then I am take bath. After that, I took the child. She is very understands. Yes, she is very much understanding. हम पेशेंट को देखते हैं वो वेरी क्रिटिकल होता है बट उन लोग उतना नियर पेशेंट को देखते नहीं है इसलिए सब लोग मास्क वेयर करना है इट्स अ वेरी वर्सल सिचुएशन and my request also all should wear mask and use the sanitizers and give cleaning.
For nurses, every day feels like a war. They step out of their houses with prayer on their lips, leaving anxious family members behind. If last year was tough, this year is unbearable. They all talk to each other, they talk to their family members, not just for moral support, but also for psychological support. These are very difficult times, and each and every nurse takes every day like a war. They believe they are going on a war front where their job is to save as many lives as possible.
But Sherry is not alone. In Surat, Dikshita, an emergency medical technician, has been toiling hours every day, managing her family in her little free time. She had shot to limelight during the first wave last year when she kept doing her job while being pregnant.
मैं 12 घंटे यहाँ पे ड्यूटी पे आती हूँ घर पे जाके पूरी सैनिटाइज़र फ्रेश होके ही मेरे बच्चे को गोदी में लेती हूँ उससे पहले उसको टच भी नहीं करती और मुझे गर्व है मैं 108 में EMT की पोस्ट में काम कर रही हूँ मेरे को सेवा का एक दूसरी बार मुझे मौका मिला है इसमें मुझे गर्व है.
India salutes these unsung heroes in the battle against coronavirus. With Aishwarya Paliwal in Delhi, Bureau Report, India Today.